we may very well be live. So let's head back to Zoom. Tina, can you see us?
Yep.
Hi, everybody. So we're back again at 6 o'clock UK time, and we are the Holistic Vet Sisters. So as many of you know, because you watch us a lot, and thank you for doing so, thank you for supporting us, and thank you for sending in all your questions. We are a group of naturally inspired holistic vets, or myself, I'm a nutritionist who is one of the founders of the APNC. So we have another sister with us today. There's going to be many guests, and if you have a look at some of the videos that we've done previously, you'll also find lots of topics as well. So do have a look at our previous videos before posting your question, because we may already have covered your topic. But today we are here with another sister, a new sister to us, Dr. Victoria, who is a practicing vet over in Switzerland. We're really pleased to have you. We've just had quite an excited discussion about all the possible things we could talk about today for you on Holistic Vet Sisters. And we know we've had some questions that have been hanging around for quite a while, so we're going to try to cover those as well today. But first of all, I would like you to properly meet Dr. Victoria in her own words.
Thanks, Caroline. Hi, everyone. So actually, I'm from the UK originally. I've been in Switzerland since 2011. And I would say that I was working with sports horses from a regulatory perspective, and I was seeing a lot of horses getting acupuncture. And so I decided to go and study acupuncture, was pretty naive about it, and ended up randomly studying traditional Chinese veterinary medicine. And I would say that's how everything changed for me, my whole perspective of medicine. I can see Tina's nodding her head. Probably it's the same thing.
Yeah.
I was quite disappointed that actually we didn't learn anything about this in Western vet school. But that was really a turning point for me. And then from them, I have studied Chinese herbals, Chinese food therapy. I then went and studied natural nutrition, because it's great talking about energetics of food, but if you don't know how to balance food, then it's maybe less ideal. I see a lot of people doing food incorrectly. I'm totally all over natural feeding, but we need to make sure it's done correctly. And more recently, I decided to go and learn chiropractic. And I have to say, actually, this is kind of out of respect and in memory of my recently, well, just over a year ago, deceased dog. He had degenerative myelopathy, and actually it was a chiropractor who diagnosed him with that disease. When I finished vet school in 2007, we knew very little about it. We didn't have the genetic markers at that time. And so I would drive nearly 2 hours once a month to take him to see the chiropractor as part of his management of his degenerative myelopathy. So I started my own practice here in Switzerland 2017. And I'm really doing holistic care, Chinese medicine, chiro, and natural nutrition now.
Only. That's heaps. That's such a wonderful veterinary centre. I wish he was up the road from me.
Yeah, only. I still do x-rays. I stopped doing most surgeries, and it involves electroacupuncture for the analgesia, which is really exciting. I mean, those guys, they wake up and 5 minutes later they're running around the clinic and eating. It's really, really nice.
Yeah, it's fantastic. So do we want to start with some questions that relate to Victoria?
Yeah, so we were discussing earlier about the antibody titers, and you mentioned that you also do it in puppies, and we were excited to hear more about it.
Yeah, I think the thing is that we really need to look at why and where the advice has come from to be vaccinating puppies from 6-8 weeks, and then every 3 to 4 weeks going forward until they're around 16 weeks, and then again at 26 weeks. And that's a lot of vaccines. Some of those guys, if we follow protocol, they're getting 4 or 5 vaccines. And if we look at, let's say, the 3 diseases that we can test for, so parvovirus, hepatitis, and distemper, and let's just say, first of all, the hepatitis at least in my area of the woods, we don't really have it. We have maybe some sporadic cases occasionally, but if we're looking at risk benefit, it's not the disease that we should be most concerned about. Parvovirus, we do see quite a lot of. And we do have distemper in the wild foxes and so on in the region. So it's less of an issue, but it is there. And so I started reading into it, really, like trying to understand, like, why are we doing so many vaccines? Because actually, if we give one vaccine at the right time, it actually seems, well, according to the data sheets, so now we're advised to revaccinate every 3 years. But if you actually look at the data, that seroconversion, so the presence of antibodies following a vaccine, it's on average 9 years. 9 years. So for, like, I have a boxer, his life expectancy is maybe, if I'm lucky, 12 or 14 years. Maybe one vaccine or maximum 2, it's enough for him. So then I started thinking about it. Okay, but what about these puppies? They're getting vaccinated over and over and over again. Why can't we pull blood and titer check? So I kind of have fought quite a lot to keep those titer checks available in my practice. So I do have patients come in, I pull blood, and I get the results within 20 minutes. So before they leave my practice, I know where we are and what we need to do, should we say. And then I started thinking, well, why don't we do this for puppies? This repeated need to vaccinate, it's not because they need those repeated vaccines. It's because the maternal antibodies, so when the puppy's born, if everything goes well, according to plan, of course, there can be exceptions to that, but they will go and feed from the mother, from the bitch, and they should get that first colostrum, which is super rich in antibodies. And the whole point of that is so that those puppies or kittens or any other animal, including ourselves, we have some antibodies to the diseases that are circulating so that we would then be protected whilst we're juvenile. And then I started thinking about this and said, okay, that's fine, but then why are we doing all these vaccines? And actually, when I looked into it, really the details, it's that we don't know how long those antibodies from the mother, the maternal antibodies, are lasting. And that is why actually maybe they're not there at 6 weeks already, maybe they're lasting till maybe 16 or even 20 weeks. And this is where that protocol has been developed from, is that we don't know when the antibodies, the maternal antibodies, are no longer present and circulating in those puppies and cats and so on, kittens. And so then we just repeatedly vaccinate them so that at some point, the puppy's own immune system is going to react to the vaccine and create its own immune response. Okay, great, but then we can test that. We can find out where are we with antibodies from the mother, maternal antibodies, or do we have them from the puppy? The point is that we don't really know what age. And so what I started doing was, instead of doing vaccinating, well, I don't get so many puppies at 8 weeks, but occasionally I do get a breeder that comes in. So we can pull blood from them and we can check antibodies there, yes or no. Pretty simple. Maybe we have antibodies to parvovirus, but not to distemper, or the inverse. But if there's antibodies circulating, then that individual is protected at that point in time. The point is at 8 weeks, if we haven't had a vaccine and the puppy is protected, then those are maternal antibodies still. And if I or any of us go and vaccinate a puppy with maternal antibodies that are circulating, that vaccine stimulates maternal antibodies, and it's not stimulating the puppy's own immune system. So we're not generating the immunity that we're looking for. So actually, we're just injecting a foreign body, a foreign substance for no reason. And when you look at the adjuvants that are added and we're repeatedly giving that, that's quite scary.
It is.
So then what I started doing was, okay, so let's pull blood, let's see where we are. Antibodies, yes, antibodies, no. Antibodies, yes. If we haven't had a vaccine, it means they're from the mother, from the bitch. If it's a little bit older, which is normally the kind of patient, so I'm seeing they've normally had one vaccine from the vet with the breeder. So then I see them maybe around 12 weeks of age. So we pull blood. Antibodies, yes. Antibodies, no. If there's no antibodies at 12 weeks, I know that that vaccine at 8 weeks didn't do anything, because if the puppy had reacted to that vaccine, he would already have developed his own circulating antibodies. So if at 12 weeks we don't have any antibodies, that's an indication to go and vaccinate that puppy. If at 12 weeks I still have antibodies, or if I have antibodies, I don't know if those antibodies are from the bitch or if they're from the vaccine. So actually then I'm in a situation where I just don't know, but what I do know is I shouldn't vaccinate that puppy at 12 weeks of age. So then I wait. I tend to take the protocol of this 8, 12, 16 weeks, but there would totally be arguments to be doing those vaccine checks every week or 2 weeks. I mean, if we want to really protect our puppies and know what's going on, we should be doing it more often. But obviously there's cost involved in that, and then it becomes a bit difficult. But so basically we need to know antibodies, yes or no, and we need to find the window when the puppy's immune system can react. Otherwise we're just injecting for no reason. So I a lot of people say to me, what, you're pulling blood from like 8 and 12 and 14-week-old puppies? Yeah, I am. Yes, I am. But I don't do consults in 10 minutes or 15 minutes. I have that puppy come in, I talk to the owner, we play, I give them food, I have toys in my consult rooms, and I don't want to stress that puppy. So if I find that the situation is turning into a stressful event, then I stop, because at that kind of age, particularly in that 10 to 12 week window, any kind of traumatic event is going to have lifelong effects, and I don't want the puppy being scared of coming in. But my experience has actually been quite the opposite. Most of those guys come in, they like coming in, they play, they get their treats, we hold them respectfully for the blood draw, and I just need 1 drop. So it's not like I need to pull 5 milliliters or anything, it's really just 1 drop. And sometimes if we just get enough in the needle, and my nurses are really, really awesome, they get enough to do the vaccine check with just this like 1 drop, really. And it's pretty awesome. Those guys, they love coming in. I probably would say I have the opposite problem, that they're just too excited sometimes. So yeah, we're being careful about it, and we're not traumatizing them. And then we're vaccinating them based on science and determining when they need the vaccine. So I don't know if that's clear if any of you guys have questions, or you want to make a few comments about that, but that's basically how I've been doing it.
I think it is clear. I think it's really clear. If only it was something more of us would do, that vets would offer, and
it's becoming more and more common, definitely. And I think it's such an exciting field. I came across this first quite a few years ago in Holland, where apparently it's quite common, and my response was exactly what you were saying. What, you're drawing blood from little puppies? And they were just saying, yes, of course. it's not an issue, and I think it's just brilliant. But it does mean you have to have some, as the owner or the breeder has to have some understanding of what's going on, like you just explained really beautifully, is the difference between being vaccinated and being immunized. Because being vaccinated just means that someone injected the vaccine. It doesn't mean it did anything. Yeah. And you need to understand that, because there's only one of the puppy vaccines ever that will work. It's only one of them that immunizes the puppy. And the only reason we give 4, if you follow the guidelines, is that we don't know which one. So there's a little bit of kind of carpet bombing going on, because one of them will work, but we don't know which one. But you can find out which one. And I think it's beautiful and very well explained. I don't worry so much about titer testing puppies every 2 weeks or something like that. I don't think it's necessary, because we've got herd immunity. That's why certainly in countries where the adult population is vaccinated and these diseases are relatively rare, I don't worry about puppy. There will inevitably, however well you time it, even if you do a blood test every single day, and the minute it goes negative, you vaccinate that puppy, there will still be at least a week or 2 where that puppy's not protected. It's just inevitable, and I wouldn't worry about it at all. The only thing I want to add is that I still hear people ask, how long should a puppy be isolated? When can we let the puppy out to play? And certainly my answer to that is a puppy should never be isolated, and a puppy should play, vaccinated or not, always. the risk of not being socialized properly is much higher and much more potentially damaging to that dog's longevity, really, than the risk of catching one of these quite rare diseases. Would you agree with that?
Yeah, and it's about risk management. If we're taking the puppy to a dog park or a training center or in the middle of town, I mean, yes, there's herd vaccination and protection, but it's also lower risk. If we're letting them run around in the forest in the middle of nowhere where maybe there are foxes and there is a higher risk of distemper virus, it's not quite the same thing. So I think it's risk mitigation. But what I have also been doing is, and I had a case, it was a breeder. She picked up a dog. A lot of our dogs are coming from France because breeding in Switzerland is very, very complicated and costly. So she'd gone over to France to get a continental bulldog, and he was diagnosed with parvovirus like a week or two afterwards, and he was hospitalized at the university hospital, and he survived. Yes, I don't know how much she spent making sure he got through that, and I'm sure it was thousands. But then she said to me, "I'm getting another puppy." And I was like, but you have parvovirus at your house and in your garden, and parvovirus can hang around for up to 2 years. And I was like, yeah, but we can't take the risk. She's like, I'm going to put him in isolation. I said, you know what? Come to me the day you pick up your puppy. Let's pull blood and let's see where he is, because then we know. And a really awesome breeder, because that poor puppy, I mean, he drove like 8 hours in the car, probably the first time he'd been in a car. He came by my practice. I mean, I played with him and he was totally cool, but the poor guy was obviously going to be stressed in that situation. So I pulled the blood. I did the VaxiCheck titer test whilst I was there playing with the puppy, and he didn't have any antibodies, parvovirus. So it was the moment to vaccinate him, but it also meant he was definitely not protected. So we vaccinated him. She took him home. She isolated him from, well, she put him with other dogs that she has that she knows are protected, but she isolated him in respect to running around and potentially being exposed in the garden. And I asked her to come back 1 week later to redo the test, so we would know, has the puppy now developed its own immune response, and does it have circulating antibodies to parvovirus or not? And actually, I went and looked in the literature, because it is written that from 3 days they can actually develop immunity. So it can be quite fast. But anyway, we pulled the blood and no antibodies. The distemper was good, but I was worried about parvovirus. So I said, listen, I'm sorry, we don't have any antibodies yet. And she's like, can you revaccinate him? I'm like, no, it can take longer than 1 week, so we just have to wait. And she came back, this breeder came back 1 week later, and she drives an hour to come to see me. She came back, we retested the puppy, excellent titers, parvo was like 5+. And I'm like, okay, now that puppy can go anywhere, and I know he's covered. And I did the same for my puppy. I have a puppy who's nearly 2 years old. I brought him home, 12 weeks of age. I pulled blood from him the next day, and he had antibodies to parvovirus and distemper. So I knew we could go out in the forest. We could go anywhere. I knew he had antibodies. What I didn't know is, were they his or were his mother's?
So you retested?
I did, repeatedly.
Yeah.
According to the normal vaccine schedule.
Yeah. I think it was very well explained. However, I do have one question, just as a practitioner. How much does it cost to have one of these antibody titer testings in your clinic? Like, how does it work?
So we use the VaxiCheck. I think there's another brand out now, but anyway, we use the VaxiCheck, which is the original one. You buy
BioGal. The company's called BioGal. Yeah?
Yes, exactly.
From BioGal. Just
BioGal, they're based in Israel. And at one point I was shipping them in from Israel because the Swiss and then the German providers stopped providing. I was quite, let's say, pig-headed about the need to have these titer checks in my practice. So anyway, you can buy the kit, 12 tests. And in the beginning, I was throwing out more than I was using when I first opened the clinic, because they're only valid for 1 year, because they're not super stable. They have to be stocked in the fridge. And so I would say the test kit that I sell to clients is around 35 euros, more or less.
That's not bad.
Yeah, it's not expensive.
For us, it's like 100 euros. We have to send it to Germany or something, and it takes.
Oh, no. That's a really important point as well that I always make to clients when I talk about titer testing is don't any vet can send it to a lab, but it's not the way to go. It becomes far more expensive, and the response that you get back is far more detailed than you need, and half the time the vet doesn't know how to interpret it. The way to go is to go to a practice that has the in-house kit. They're fully validated by the WSAVA, and we use the Vaccine Check as well, and have done for 20 years, I think. And it's really simple and it's really quick, and you don't have to do them straight away. If you feel that 20 minutes is too long, you can just take bloods during the week, put it in the fridge, and then run them when you've got 12, or if you've got 2 hands, you can do 24. If you've got a student or something with you, they can sit next to you and do the same thing, and you can actually run quite a few of them at the same time. So that sort of thing that could potentially raise the cost is taken out of it. And generally speaking, I would say it costs slightly more than the vaccine, but not much more. And since they're certainly, if the dog is more than 1 year old, they're always positive, is my experience. So people are always worried, what if they're negative and we have to vaccinate afterwards? It doesn't really happen. And if it happens, I would test to see if it's a non-responder.
I've had it loads, honestly, with my nutrition clients. Loads of people come back and say to me they've had some of them have no antibodies, and then you have to go into the whole explanation of that doesn't mean they're not immune.
No, I would follow. There's no point in doing the titer test unless you're going to follow, unless you're going to vaccinate if it's negative. The negative ones are typically the dogs that have only had puppy vaccines. They're negative quite often.
Yeah.
So if the pup is up to, say, 15 months old, under 15 months old, and has only had puppy vaccines, they will quite frequently be negative. But what that means is this dog was never immunized. This dog doesn't matter whether it had 1 or 4 vaccines, it was never ever immunized, probably because it was blocked by maternal antibodies. So, and those are the ones that we catch by titer testing, and then we vaccinate them, of course. But once they've had,
those are the ones, and I would say, because titer testing is so underused, we should, at that 26-week 6-month checkup, I would say we should be titer testing everyone, because then we know, are you immunized or not? And I actually feel more confident using those titer tests, because I know, are there antibodies, yes or no? And at 26 weeks, the risk that would be from the mother, it's not totally excluded, but it's pretty low.
It's very close. It would be
exceptional at that age. And the ones that I think, I look a lot at the vaccine history, Caroline. I don't know if you are, but what I find is the ones who come back negative, often they only had the 8 and 12-week vaccines. And then at some point, the owner's gone, oh, why do I need to keep vaccinating?
Yeah.
And the problem is also that some of the vaccines will say that they, they can provide, some of them even, I think, still say after 10 weeks, even though the WSAVA guidelines say the last vaccine should be given at 16 weeks. Some vets only look at the vaccine product itself, and if it says it's okay to give the last one at 10 weeks or 12 weeks, you just risk having puppies who have been vaccinated at least twice and never been immunized. That's actually where I live. Parvovirus is quite rare. In London, I saw it quite a lot, but where I live now, I see it very rarely. But we've just had an outbreak where several puppies were fighting for their lives from parvo, and they were all vaccinated at 10 and 12 weeks and not again. And clearly, they were never immunized. And like you say, a simple titer test, I'd generally recommend doing it between 16 and between 4 and 6 months. Everybody should have a titer test. I couldn't agree more. And that would have caught those and saved them all this,
And because the thing is, by charging for titers instead of vaccines, the practice income doesn't really alter a great deal. So we can't be saying that they're doing it for the money, because you could completely change how you're doing things and still be making money. And the way we're discussing now is actually better for protection. So,
oh, no doubt.
Why on earth are we what is it? You know what I mean? No, it makes no sense. No logical sense.
No, Caroline, I have heard from colleagues in the region, because I have the clients that then move away from my area and they go to someone else, and then I see them again for whatever reason. They come back and they say, the vet said to me, I'm a man of science and titer checks are not scientifically validated.
Wow. How are they not?
What?
Oh, but that's just crazy.
Sure.
I know. And so what I did actually is, because we do like a certification of the results, and I copied 2 pages of the WhatsApp text and translated it into French, because I work in French. And I put that on every single certification I send out. So when they go to their vet, they can say, yeah, but I read this. Now you read this. I, as the owner, informed. I think it's time that the vets start getting informed. It's really, really crazy. And to come back to your point, Tina, about how it works in practice, actually what I do is I have 2 offers. The first one is that they come in for their annual wellness. They don't come in for vaccines. They come in for wellness. And actually, Wasawa have been saying this for years. We need to stop doing vaccine appointments. We do wellness appointments where we evaluate the need for vaccines. And so what I do for convenience is those guys that come in, so they don't have to come back potentially, I pull the blood, the nurse will run it, like she sits there for 20 minutes running the test for me, so we can make a decision before they leave the practice. And what I do is, if they need a vaccine, the practice gives it for free. And I really mean the practice gives it for free. It's not like calculated into the cost. The cost is more expensive because I have the nurse sit there at the time when she could be doing other things for 1 dog, 1 cat. And so we get the results quickly. And so the client pays a little bit more for it. But then we offer another option, and that's what we call the grouped titer testing, where once a week we run all of the blood that's been sitting in the fridge where clients have requested the titers, and it's so much cheaper. It's, I would say, less than 60 euros.
That's still good. Still good.
I also have another question, probably for Lisa, about homeopathic nosodes. So what about if you don't vaccinate at all and just give homeopathic nosodes to puppies?
That would, in my view, be a huge misunderstanding. I write about this in my book. I mean, homeopathic nosodes certainly can work. It has been demonstrated that they have an effect, but they don't provide an antibody response. So it's how would you know? I mean, you can't just give a dog nosodes against everything every day. I think it would be a huge misunderstanding. What I write about in my book is an example of how I would use nosodes is if I mean, I handed some out today, is if there's a kennel cough outbreak, then sure, have a kennel cough nosode, because you know that maybe you've got several dogs. This lady I saw today has got several dogs, and one of them's just come home from a dog show and is now coughing. Give all your dogs kennel cough nosodes to try and shut that down at home. That would really be the situation where it makes sense. If someone's been exposed to something and you for a week or 2, give them an nosode every day. But it's not something that is a safe option instead of vaccines. But having said that, we don't need alternatives to vaccination. We just need to understand vaccines and use them properly. And I'm doing it myself now, but it can be misguiding because people talk about vaccines as if it's one thing. There are so many different vaccines you could give to a dog, but actually, most situations, the dog only needs protection against parvovirus and maybe distemper, just like Victoria said. The core vaccines, and it's really only 2 out of those 3 core vaccines that are relevant, but they all come together in most products. And in most situations, that dog only needs 1 shot for life. So when we talk about, I don't want to vaccinate my dog, in lots of situations, if you know what you're doing and you time it right to protect a dog through vaccination for life, they'll need 1 shot against 2 or 3 diseases in 1 shot. that's it. So we don't need to be given 5, 6, 7 diseases every year, or in some pulled out of the sky made up schedule of alternating them, or whatever people do randomly. You can protect a dog fully through one shot if you time it right, and you only really need to give the core vaccines. And that's not, I mean, this is not something I'm making up. This is what the WSAVA says if you read it properly. Yeah. So I don't think we need an alternative to vaccines. We just need to use the vaccines safely and appropriately.
And maybe if people are concerned, we could consider something that helps support the liver to remove the adjuvants, or support the body to cope with whatever else comes with that vaccine. I think that's probably key as well. If you're naturally minded, you know, you might take what you're saying about the virus itself, live or inert, but you might not want the adjuvants and all the other bits.
Sure. And we talked about that when Vicky was our guest, actually. You know, when you give that one shot very often, which is all that's needed, sure, give Thuya or give whatever you want to do to support the animal around that time. Yeah.
Yeah, I'm homeopathy is definitely an option. I don't practice homeopathy. I do a bit of homotoxicology, but it's not the same thing. But I use Chinese herbs, actually, because what is a vaccine, Tina? It's a massive heat invasion, toxic heat.
Yeah. So
you clear toxic heat. Help the body clear that toxic heat.
That's perfect. Maybe we should jump on to our second question, so we have time for at least 2. We did have some questions regarding our thoughts on Librela and Solensia, and I know also Victoria has a lot of experience with pain medication and such. I don't know if you want to start off on Librela, Solensia.
Yeah, that's a massive topic. Huh? Where to start? I guess if we want to address the question of Librela and Solensia, we could potentially also put Cytopoint into that discussion. So we need to understand what those medications are. They are monoclonal antibodies. So we are, again, we're touching the immune system. We are sending an antibody into the body to block something. In the case of Librela and Solensia, it's very specific to the species. So we're blocking nerve growth factor. And nerve growth factor is massively involved in the perception of pain. So those are symptomatic treatments. They treat the perception of pain. And if we talk about Cytopoint, which I sort of add as a side point, it's blocking interleukin-31 via the same sort of concept of an antibody, monoclonal antibody. And it's this, in a lot of cases, it's interleukin-31, which is kind of responsible for this perception of itch. So that's why it's used in a lot of atopic dogs. It is not treating anything. It is not dealing with the underlying cause. It is not treating the skin infection or otherwise. So I think that's the first thing, is to understand what it is. With regards to Librela and Solensia, so as I said, they are blocking nerve growth factor and the perception of pain. But nerve growth factor is not only involved in pain and in the nervous system. Well, the nervous system is everywhere. And so actually, what we see is that nerve growth factor is decreased in canine cognitive dysfunction and in Alzheimer's in people. So if we go and block the little nerve growth factor that is remaining and functioning, then we can worsen cognitive disease. And maybe we're not seeing it before, but then it suddenly gets worse when they're receiving Librela or Solensia. Nerve growth factor is also present in the gut. And I recently actually did a consult with a dog who'd received Librela. He'd presented to the vet because he was throwing up. And at that consult, the vet said, "Oh, but you know, he has arthritis. So I have this miracle drug. Let's treat the arthritis." So they injected Librela as well as treating the vomiting. And that dog, just his whole gut just sort of exploded, like chronic liquid diarrhea, collapsing, fever, translocation bacteria. I mean, it was a disaster. We got his gut under control. He's having other issues now. He's drinking like 3-4 liters of water a day, and without really, I mean, there are a couple of changes on the renal screening, the kidneys, but without really any explanation. So if I come back to nerve growth factor implies nerves, implies the nervous system. So any dog that has any kind of nervous system dysfunction, if we block again the little functioning that they have, it's only going to make it worse. So Solensia and Librela are licensed for arthritis, pain management of arthritis. I repeat, arthritis. Because how do we diagnose arthritis? I mean, should we take an X-ray? But we know that X-rays are not diagnostic for the cause of the pain. We can maybe see arthritic changes, osteophytes or otherwise on an X-ray.
If it's been going for a long time.
And maybe that is the cause of the pain, and depending on the severity of the lesions, it probably is involved. I mean, all old patients have arthritis, full stop. They all, according to Chinese medicine, get kidney deficiency. They all get Jing deficiency. Their life essence reduces, and they all end up with articular problems. That is just part of life. And so as a result, I feel like we are diagnosing arthritis as the problem. How do you diagnose it? How do you know what joint really has arthritis in? And how do you know that it's the only arthritis that's the cause of the pain or the lameness or the irregularity that you're seeing? And I had a discussion actually this week with an osteopath, and I said, what is the biggest thing that you treat? And she said pelvic issues. And that's funny because in chiropractic, region number 1 is the pelvis. And so if you actually start looking at it, and I am looking a lot at the spinal column at the moment and the vertebra, are those guys arthritic or neurologic? And is the neurological problem because of the arthritis? You can't separate them, which means that a lot of these old patients diagnosed with arthritis that are getting these shots, Librela and Solensia, are actually decompensating in quite spectacular ways neurologically. There are also some that are getting seizures. There are also a lot that seem to have renal issues going on. PUPD, so polydipsia, polyuria, so drinking a lot and therefore peeing a lot is actually listed as a side effect. Recently, according to, this is another interesting thing, according to the jurisdiction, so I live in Switzerland, but I have looked at the Canadian and the US and the UK data sheets on these products. They are all different. And so it's really strange because in the USA, it seems they have less side effects than what they get in Canada. Yet the scientific tests that they did were exactly the same. I mean, how is that possible?
How is that legal to write and not write some of them?
Because each jurisdiction, and this, I mean, there's a really great book, Deadly Medicines and Organized Crime, about how the pharmaceutical industry works. And I think this is a really great example. So recently in some areas, death has been listed as a side effect, recently added as a side effect for Librela. And I think that speaks volumes.
In what country?
I think it was in the US, actually. But I've read so many of them now. Honestly, I'm not sure. I'm not 100% sure anymore. So I have a guy come in. He has pain. Maybe it's arthritis. Maybe it's neurological. Maybe it's whatever. Let's give this miracle drug that has no side effects according to how it's been presented to veterinarians. Cool, no side effects. There are definitely side effects to that medication, and it is widespread across the whole body. And a lot of dogs do get better with it, and a lot of cats have great results. The cats seem to have less severe reactions if they're going to have side effects. But is it worth the risk? There's so many other options for pain relief. I mean, I do acupuncture. I mean, it's incredible. Those guys, I mean, you do one treatment on them, you treat the kidney or whatever else is going on, and they get better. And Caroline, what I also find is a lot of those guys with a lot of chronic pain, they are overweight. And if you address the food, they get better as well.
Yeah. Yeah.
And there are so many really basic things you can do, like feeding correctly. And there are studies where we've seen that actually keeping a dog slimmer or feeding less calories during their lifespan. There was a study in golden retrievers where actually they lived for 2 years longer if they were fed less calories. I mean, it's basic stuff. It's the same for us. Just don't overfeed your dog and get them moving.
And feed them the right thing.
Yeah. Yeah, get them moving is really key. People don't realize that because so much energetically is within the water in your fascial system. So, you know, if you're not moving that, you're not really moving your vital life force at all around your body. It's no wonder it stagnates.
Yeah.
Stagnation, that's the thing in Chinese medicine as well.
Yeah, and so what I do with a lot of the old guys actually, and I talk to them about how much you're taking them out, and they're like, oh, but you know, they don't really move anymore, and it's a Chihuahua that's maybe 18 years old, and yeah, we just go for a pee, and I'm like, can you just start taking her out? Like 5 minutes, just get her on her feet, sniffing. She doesn't need to go walking 10 kilometers. She just needs to get up and have some enrichment outside. I don't care that she walks only 5 meters or 10 meters, but she just needs to get out there. And that makes such a difference as well, because they start loading their joints again, activating their muscles, the chi and other energy starts moving. Really, really basic stuff. But no, we inject Librela.
It's so I think it's because they don't know as much about the alternatives.
Can I
happening? Go on, Lise.
When you say that, can I quote my own book? Because I have a ladder. I have a list in my book, which is kind of like a ladder of what to do for dogs with locomotor problems, you know, arthritis or early arthritis, or even just arthritis being a known risk factor. And the way I mean this, the way I intend this to be read is, first you do step number 1, and then if that's no longer enough, you do step number 2, and if that's no longer enough, you do step number 3. And it starts with nutraceuticals, fish oils, glucosamines, green-lipped mussels. And I would do that to any elderly dog, certainly any large breed elderly dog, or dogs that have had maybe knee surgery, or any situation where you know this is a risk factor for developing osteoarthritis. So that's step number 1, is nutraceuticals. The second one, like Victoria just said, is weight restriction, swimming and other suitable physical activity. The next one is osteopathy or chiropractic, physiotherapy, massage, you know, when you start to get issues. The next step is acupuncture, maybe gold implants, and homeopathy. And then the bottom or the top of the ladder, depending on how you read it, is pain-killing medications. And at the bottom of the list of possible pain-killing medications comes Librela. Yes. So it's the last thing you do. But what happens these days is that people will often go into the vet and they'll say, oh, I think he's got arthritis, let's give him Librela. And in my world, that's just shocking. First you do all these other steps, and when they are no longer enough, and when other medications are no longer enough, then Librela can be life-saving. I've seen old dogs who've really had a second lease of life with Librela. But I think it's when you're at that end stage, we can no longer take away their pain. Are we even thinking about euthanasia at this stage? Then Librela can just really give them back their life. But it's not something that you put a young or middle-aged dog on without having had acupuncture or any of these other options. So it's where it fits into the management for me is how I look at it.
It's palliative.
Yeah, exactly. Yeah.
Last line. Okay, we can't do anything else. We're aware of the risks. We try it. If it doesn't work, then in any case, euthanasia was the option. So yeah,
this is basically what I do in my clinic as well, very much like Lisa said. Obviously, it depends when they come in, if they're already pretty bad when they come in, or if they come in early when they're just a little bit stiff and they're noticing they're slowing down. I've actually even written a PDF with all things that they can think about, because, you know, working in conventional practice, we never really have time to actually explain everything. So I've written everything down, as well as like lifestyle modifications at home, having carpets and ramps instead of stairs, all those kind of things, and then focus on the nutrition, potential supplements, and then consider things like PEMF, acupuncture, chiropractics, osteopathy, hydrotherapy, all those kind of things. I give it out in my consults, and I actually also add it on social media if anyone wants to use it. It's for free in the link in my bio if anyone wants to use it in their clinic, because sometimes it's hard, even for conventional vets watching, it can be hard to have time to say everything. So there you have everything written on one PDF page, very small letters. And then, yeah, going forward, talking about Librela as well, I just feel like there's so many options to use for arthritis and pain. Like once you've diagnosed and you know that that's that's what it is. I find quite a lot of luck with like low dose ketamine subcutaneous injections. I've used cartrophin quite a bit as well, which is more natural, and it's like an injection you can do like a set of 4 maybe once a year. For me as well, I think Librela is kind of like the last solution. Obviously, it has changed the life of a lot of dogs, and you can't overlook that, but also has a lot of side effects. So it's really a question, risk versus benefits for me. It's like the risks are quite high in this drug, and I feel like it needs to be worth it for like if it's like towards the end of life, and that's like the last kind of option.
Yeah.
Lise, did you say gold implants?
Yes.
Say that. I need
sometimes it's called. It's sometimes described as a form of acupuncture. You put these little. I always used to think of it as gold beads. It's not actually. It's little sort of, you just cut bits of a string, but you put them in. An
acupoint.
You're supposed to put them into acupuncture points. It's become quite common among vets, and some vets don't know where the acupuncture points are, so they kind of put them around the joints. I always recommend that you get it done by someone who's also a proper acupuncturist. But for some dogs, it can really, really take away their pain. I think especially dogs who've had acupuncture and responded well to acupuncture, but had to, if you've got a chronic condition that's not going to go away, and it's the pain is relieved by acupuncture, sometimes you can end up doing it with longer and longer intervals. But if you're in a situation where this dog needs acupuncture every week or every other week, it can become quite demanding and quite expensive. And for those patients particularly, having these put in so that they're constantly stimulating those points can really make the difference. I've had loads of patients who've had this done, and I refer quite a few patients to get it done. I had one, but like I said before, I think it is really important that the person who does it knows acupuncture and knows where to put them. I had a case that I won't forget, which was a very elderly couple who brought in their very elderly dog, and they were all, really kind of struggling to get into the room and into the chairs, and the man and the woman and the dog were all very slow and elderly. And what happened is the woman had this done, and just absolutely her pain was gone. And so they immediately took the dog to get it done, and it didn't work. And she was so convinced from having had the experience for herself of becoming pain-free that she took the dog somewhere else and had it done again. And then the dog experienced the same effect. So I thought it's a really nice illustration that you can't just say, oh, we tried that, it didn't work. It has to be done properly. But it can really, really make a big difference.
I need this.
Gold bead implants I think is generally
right. The first thing to do is actually get an acupuncture treatment and
see if it works.
Points are working for that individual. And if you're not getting a response,
exactly.
And I mean, we all have our own way of using acupuncture, I would say. I do a lot of distal points, command points, but maybe that's not the right thing for certain patients with chronic pain. Maybe you need to go closer to the joint that's involved, but you definitely need to specifically treat those points that you're thinking of putting the gold bead in to validate that it's going to work before you go ahead. Because it's an anesthesia. You're not just sticking gold beads in like acupuncture needles. It's quite an important intervention. It's not something just to do, let's just stick gold beads in the patient.
No.
But if you have a patient that responds to acupuncture,
yes,
but needs acupuncture once a week to maintain the effect, then it can really, be the thing that means that they can remain pain-free and not have to go on to opiates or Librela or, other high-risk treatments.
Yeah, totally. On the subject of Librela, as I said earlier, I had a dog with degenerative myelopathy, and actually it's a great example because at some point I x-rayed him. I sedated him for x-rays, and he'd always had a laxity. I adopted him when he was 5 years old, and he'd always had a stifle issue going on. And I never x-rayed it because we were managing it with acupuncture and I didn't really feel the need to. So anyway, at one point when he started having these mobility issues, I said, okay, let's sedate him. Let's get a good series of everything. So I x-rayed both stifles, lumbosacral area, a couple of other joints along the way. And I just, in the series, I was like, that's his stifle. It looks like a cauliflower. It was so modified from the degenerative changes. But he wasn't lame on that leg at that point. It was actually the moment when the DM was starting. And actually I had a colleague say to me, why don't you give him Librela? And I didn't know it was DM at the time. And I am so glad that I listened to my gut and didn't give it to him, because it probably would have just totally taken out his hind end. But the point I really wanted to make as well is that food is so important. Feed good quality protein. My guy was not able to walk using his hind limbs for 5 months. And he was being followed by a physiotherapist. We go once a month to the physio. And she was like, I don't understand it. He's been down for like 2 months. How is he so muscled still? And it was partly because of food, because he was getting good quality protein and, let's say, lots of it. But also because he had the carts. So he was actually, even though he couldn't stand up because he didn't have the physical strength from the neurological problem, he was still engaging those muscles, even though they weren't weight bearing. And particularly along the spine, he was really well muscled, given that he was a dog that couldn't walk. So food, it's amazing.
Absolutely. Well, it's what makes you up. Absolutely. Yeah. I mean, viewers know, but you don't. But I have a 3-legged dog, so it's imperative for me. This is interesting conversation. I mean, she hasn't had acupuncture. She's incredibly sensitive, very, very sensitive. And because I've had it a few times, I've mentioned before, and neither practitioner were able to do it without it hurting me. So it's kind of, if I take food, so she'll probably never forgive me.
I use laser in those guys, so I don't stick any needles.
Yeah, she has other treatment, but yeah, that's a good idea. Doing
laser acupuncture. So you stimulate the acupuncture point using laser. Even another wonderfully.
Yeah, I wonder who does that. We'll have to find out over here. I don't think Vicky does that, does she? Laser acupuncture.
There's a few in the UK, I know.
Excuse for a weekend away to take Fusa for some laser acupuncture.
Yeah, I was a bit skeptical in the beginning. There was a very well-known acupuncturist, Linda Boogie, who was presenting about it at some point, that motivated me to go and start trying it. And actually, it's life-changing for a lot of cats. And a lot of those fire patients or really, really anxious guys. I have this old dog that came in. I mean, she can't take the dog into the vet because the dog is so traumatized and anxious and reactive. And I spent some time with her and I started treating her with laser acupuncture. And now that dog comes in, doesn't need to have trazodone or anything else to come in. I mean, I have to be careful with her because you have to respect those guys, but it allows me to use acupuncture in patients where otherwise it's just not possible. Like you can't even touch them, some of them. And like the hyperthyroid cat, you can actually, and then when they start trusting you, sometimes you start putting needles in them.
They don't notice.
I've just had a revelation. I've just remembered. Of course, many moons ago, I trained in something called acutonics, which is essentially putting sound frequencies into acupressure points. Now, I didn't train for dogs, but I did buy the dog book, which is knocking around somewhere. So perhaps I've been ignoring something I could have been doing for my own dog all this time. But that was really interesting. I remember doing that, and we had the different frequency forks that would knock and put onto different points. Yeah. So it's amazing what you can do with these points, really. Once you understand them.
You can even massage it, do we not?
Yeah, acupressure, of course, has been.
You can use chromo as well, so different color wavelengths.
Oh, light,
yeah, depending on the patient's constitution and the problem. I don't do it, but I know that there's some colleagues, especially in Italy, doing it. So it's, the possibilities are endless. There is always a solution. You just have to be willing to think outside the box about the patient that's in front of you and the client. But you can always find a solution. And sometimes it's herbal, sometimes it's food, sometimes it's laser acupuncture. sometimes it's chiropractic. Like there is always something you can do for those guys. You just need to find it.
And
well,
Victoria,
go on.
Can I ask one question now that we still have you here regarding chiropractics? Because I think a lot of people out there, maybe they've done it in themselves or something, but like for their animal, when should they see a chiropractor? Like what cases have you found it really helps? Do you have any insight on that?
So first of all, I'd say I'm a baby chiropractor.
Okay, fair enough.
So my experience is limited so far. It's not about bone cracking, which is what it's sort of perceived as. It's not about bones out of place, actually. It's very much working on the nervous system, and at least the techniques that I'm learning. I'll put a little plug in because I really like the class that I'm doing, and I find the quality is really, really good. It's Backbone Academy in Germany. They do classes both in English and in German. But they're very much about working with the patient, which is totally my style anyway, listening to what they're saying. So you're not forcing them into a situation where you're trying to adjust them. And it's very much about working with the nervous system. So when you have a muscle that's in tension, mostly what we're doing is a high speed, low velocity adjustment where we're actually activating the Golgi tendon organ. That's the principle of basically everything we're doing. And you're getting the Golgi tendon organ to relax and give a neurological feedback, then allowing the rest of that system to relax, basically. But there are other ways you can use it. There's different theories, including immune modulation. So, and a lot of it comes back to the back shoe points as well, I'm seeing, because obviously they're along the vertebra, these diagnostic points that we're using in acupuncture. A lot of guys that have gastrointestinal issues will have problems at T13L1 in dogs. And that is exactly where our earth element and our digestive problems are. And it all fits back into the same thing.
Oh.
Yeah,
but I mean, sorry, go ahead, Caroline.
No, I can well believe that, because the amount of times I have had dogs with, or clients really, and the dog is itching their feet, and it isn't the food. We've done the food.
It's the
and
gut.
have something happen here with a chiropractor. I usually, personally, I usually send to a McTimoney over here. But you know, definitely, let's put the links in the comments so that people can find the practitioners doing what you're doing. And yeah, the poor chewing stops because it wasn't actually the food, you know.
And most skin problems are not skin primary problems. Mm-hmm. You have to look at the gut.
Yes, of course. And of course, if they've got a physical structural element going on, you can be healing, for instance, leaky gut, you can be balancing microbiome, but if something else is part of the picture and you haven't noticed that, and you haven't seen somebody like yourself, it's going to keep coming back again.
Yeah.
We're going to have you back because we had more questions and we don't have time for more questions. But is there something you want to just, if you had to pick one thing that you want everybody who's got a dog needs to know one thing, what would it be? What will be your message?
I would say it extends to all pet owners and probably people with children and ourselves. It's informed consent. When you're suggested a treatment, you need to ask why are we suggesting that treatment? What is the intention of it? Is it symptomatic relief, or what is the root problem behind it, and how do we then address that? And I think everyone needs to really have a responsibility in that, and you can't just go to the doctor or the vet and just go, yeah, let's do that, and not ask questions. I think we really have to be the advocate for ourselves and our dogs and cats and horses and so on.
That is a perfect comment. Yeah, you need to be informed. You can't just push the responsibility onto someone else. You need to inform yourselves, really, is what you're saying, isn't it?
Yeah.
Don't be scared to ask.
Amen to that.
Amen to that. Well said.
Yeah.
And for Tina, this was something I discovered as well. Hippocrates said a lot of great things. He also said, if you have a problem, look to the backbone. And I never knew that until I decided to do the chiropractic.
Oh, that's interesting. And doesn't he also say, let food be thy medicine and medicine be thy
food? Yes. Yeah, and as well as looking at the backbone, look at the gut for all pathology as well.
It's amazing. I think we need to ask you more questions about that on the next live.
We need to bring him back. Let's bring him back again.
With pleasure, ladies, with pleasure.
Yeah, and you, of course, not just Hippocrates, but yeah. Right. So we're at the end, aren't we, of today?
We are.
Thank you for watching, everyone. And so next week, do we have a guest, Tina?
Oh, you put me on the spot here.
It's Amaya, we do.
Oh, we do. It's
Caroline is going away and is not going to be here for the next 3 or 4 Thursdays, but Tina and I will be here and we will have guests.
Yes. Next week about cat.
Yes.
Yes. So
next week we have Amaya, who is an amazing cat vet, but you can ask about anything. But if you have burning questions about cats, make sure to write them on our Facebook page.
Okay.
Thank you, Victoria. It was wonderful having you and meeting you. Thank you very much for joining us.
Thank you, ladies, and keep going with the work. It's not easy.
Thanks,
Okay. Thanks,
you.
everyone. Bye.
Bye-bye.